The host has started broadcasting the meeting on custom live streaming service.
So, greetings and a warm welcome to everyone. I'm Srevshi, the Ascent moderator from Clirnet. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us from across the country. We are indeed fortunate to have the valuable support of esteemed doctors, and I express my gratitude to each one of you for dedicating your time to be with us today. Allow me a moment to introduce our platform Clirnet. It stands as one of the largest live digital CME platforms in India, providing a space for doctors to create and share medical content. Now, I would like to extend a special welcome to today's distinguished speaker, Dr. Amitav Banerjee, sir. Sir holds degrees in MBBS, MD, postdoctoral in epidemiology. Sir is professor and head in community medicine at Dr. D.Y. Patil Medical College, Pune. Once again, I welcome all of you at today's lecture for the topic diarrhea. So, without any further delay, sir, I would like to hand over the session to you now. Kindly proceed with the talk, sir. Over to you, sir.
Thank you. Thank you so much. It's a pleasure to be on this platform. And I welcome all the delegates and my greetings to you from India. So today's topic is management of acute diarrhea. And it is with special reference to the African continent and with special reference to children, because most of the morbidity, mortality of diarrhea is among children. So that would be the presentation today. And this will be the scope of the presentation. Just a minute, let me get this. I'm having this meeting that describe this is we first will give you the burden of it, definition and burden, and when to use oral rehydration, when to use parenteral, identify the causes, and when to use antibiotics, when not to use antibiotics, and one of the important thing is use of zinc in acute diarrhea as well as for prevention of diarrhea. And then we will be discussing the prevention and control. So this is the definition: passage of loose stools more than 3 times a day, or in breastfed infants, usual stool frequency and consistency. There is a change in frequency constant as reported by the mother. So basically, it is more than 3 stools or very large volume of stools. So the burden is that diarrhea can be prevented. There are more than 2 billion cases all over the world, and it mostly affects children. And about more than 5 lakh children die due to diarrhea. Particularly, 80% of the deaths occurs in the African and Asian continents. It is second most common cause of death among under 5 children. And in Nigeria, the diarrhea deaths are over 1 lakh, and second largest number of deaths in this country after India. So this diarrhea continues to be a major problem, and we have to see what can be done to reduce this burden. So these are the factors, agent factors. It can be most of the diarrheas are due to viral, some are due to bacterial, and in tropical countries some are parasitic. Then there are other causes like food intolerances and allergy and other thing, but mostly we are concerned today is the infective diarrheas, and the agent is not very important except for very specific agents like Shigella or cholera, which requires special, which have got pandemic and epidemic potentials, but management remains more or less the same for most of the diarrheas, particularly in children. That is to control the dehydration. The host factor is very important, particularly in children. Diarrhea, the morbidity, mortality is most severe with associated host factors that malnutrition, and both African and Asian countries have got a high burden of child malnutrition, undernourishment. The host factor is important. Besides malnutrition, other things go with malnutrition, like vitamin A deficiency. It can predispose to diarrhea, zinc deficiency, and infection with particularly measles. Measles can prevent, if measles can precipitate diarrhea. And then, of course, the environmental factors. Environmental factors are the availability of access to water, soap and water, and proper waste disposal and proper safe water supply. So these are the environmental factors. So acute watery diarrhea and acute bloody diarrhea. So watery diarrhea is mainly due to rotavirus, viral diarrhea, and bloody diarrhea is due to Shigella. As I said, it has got a epidemic and pandemic potential. There is blood in stools, but most of the bulk of the diarrheas are the acute watery diarrhea, which is very common. And at any given time, about 14 to 15% of children are having the diarrhea, as per recent studies. Just not able to, why the slide is not. So bloody diarrhea is just to complete the discussion on bloody diarrhea, most of them are due to Shigella, and blood in stools is the main, and there is pain also and fever also. Whereas most of the other viral diarrheas, they may not be much pain or they may not be fever. There may be convulsions, lethargy, dehydration, and rectal prolapse. All children with severe dysentery, they require antibiotic treatment for 5 days. That is in Shigella. That's not, I mean, if you have bloody diarrhea, you require to investigate also, try to isolate the organism also to confirm the diagnosis. And of course, the rest of the management beside antibiotics remains the rehydration and breastfeeding to continue. And you only additional in bloody diarrhea is the proper antibiotics depending on the sensitivity, and of course, it may have to be notified and it may have to be investigated. As I said, it has got an epidemic potential. Then we have to make special in the context of severe malnutrition in most of the continents where we have diarrhea. Most of the children, or few children, many children have got malnutrition, grade 1, grade 2, but the children with severe acute malnutrition, we have to be careful when we are rehydrating these children, because they have got some sodium imbalance. Plasma sodium may be low in such people with severe acute malnutrition. Total body sodium may be increased due to increased sodium inside cells, additional sodium in extracellular fluid if there is nutritional edema, and reduced excretion of sodium by the kidney. So these are the problems in children with severe acute malnutrition, and cardiac function is impaired in severe acute malnutrition. In such treatment, in such cases, rapid rehydration with IV fluids, particularly containing sodium, can increase the toxicity or sodium overload and heart failure. The correct management is reduced sodium rehydration, oral rehydration, fluid given by mouth or nasogastric tube if necessary. The volume and rate of oral rehydration fluid are much less for malnourished than well-nourished children. The fluid should be used only to treat shock in children with severe acute malnutrition, SAM, who are also lethargic or have lost consciousness. So firstly, such people should be rapidly evacuated to a hospital with good services. And we have to be very careful. This has to be kept in mind when rehydrating them, particularly with saline in children with severe acute malnutrition. And then how do you assess nutritional status? Assessment is important in children with diarrheal disease to identify those with severe acute malnutrition. The charts are there, standard charts, which can give you the Z score, and you can identify whether the child is in severe acute malnutrition. In patients with severe total body sodium is increased. So this, as I have already discussed. So first, when the child comes with diarrhea, we have to rapidly assess the nutritional status. If the child is having severe acute malnutrition, we have to be very careful. These are particularly for hospital services. And the periphery, of course, the IV fluids may not be given. Home management is the. So methods of nutritional assessment can be done by looking for visible signs of severe wasting, such as muscle wasting and reduced subcutaneous fat. Looking for other signs of malnutrition, angular stomatitis, conjunctivitis, pallor, brittle hair, hyperpigmentation, nutritional edema, use of anthropometry. This is the weight for height, Z score. If you just plot the weight, there are standard charts available. Mid-arm circumference and so muscle wasting. So these are, the child is severely acute malnourished, severe acute malnutrition. We have to be careful when treating diarrhea. Then mid upper arm circumference is widely used in community screening of malnutrition because it is easy to perform, accurate and quick. So these are some of the measures. The Sakir strip is available, and there are the bands, red color, green color, yellow color. So if the band is red, that shows severe acute malnutrition, mid-arm circumference, older child. Laboratory investigations in acute diarrhea, mostly you may not require laboratory investigations, only for certain cases, particularly when you are suspecting Shigella as bloody stools, or sometimes in cholera. Of course, the classical cholera is not very frequent nowadays. So these are the two diarrheas one has to investigate thoroughly, because both cholera and Shigella have got the epidemic and pandemic potential. So fortunately, most of the variants are LTOR nowadays, cholera. So it has more or less endemic. And of course, in African belt, cholera is become endemic. So cholera and Shigella may require identification of the pathogen for management and for notification and epidemic investigation. But by and large, the laboratory investigations may not change the management. And what are the indicators for stool microscopy, culture and sensitivity? Blood and mucus in stools, high fever, sometimes the food poisoning like salmonella, that can cause fever, salmonellosis. This is again rodents and zoonosis, contamination of food, and high fever, salmonella. Suspected septicemic illness, and diagnosis of acute diarrhea is uncertain. And indications for, and sometimes, as I said, in tropical countries, there may be parasitic diseases like amoebiasis, giardiasis. So they also may, in those cases. And of course, the electrolytes and urea, severe dehydration or shock, we have to measure the electrolytes and urea for creatinine, also renal function. Children on IV fluids should have a good monitoring of electrolytes. Children with severe malnutrition, suspected cases of hypernatremia, high sodium, and with dehydration. So these serious illness, child with severe diarrhea and malnutrition, you require monitoring of the electrolytes and kidney function. Antibiotics are not very commonly used in diarrhea. It in sometimes in case sometimes it increases the duration and the carrier state, but in certain cases they are specifically indicated, like I said, Shigella. So even though bacterial pathogens are commonest cause of acute diarrhea, there should be cautious and rational use of antibiotics to discourage development of microbial resistance, avoid side effects, and reduce the cost. And severe invasive bacterial diarrhea by Shigellosis, that is the most important indication for antibiotic. And cholera, of course, they prescribe tetracycline group, but again, cholera also, the sea tanker of treatment is rapid rehydration. And of giardiasis, of course, metronidazole, or that has parasitic infections, amoebiasis and giardiasis, and sepsis and immunocompromised children. And they are antibiotics are contraindicated in E. coli 0137 H7 because they increase the risk of hemolytic uremic syndrome, and uncomplicated salmonella enteritis because they prolong bacterial shedding. As I said, and sometimes it increases the carrier state. So in salmonella infection, salmonellosis, though it's a bacterial infection, mostly food poisoning, there may be fever also, but still in salmonella, antibiotics are contraindicated because they prolong the bacterial shedding. So the carrier state is prolonged. And there's two important antibiotics are contraindicated: E. coli 0137 and salmonella. Shigella and cholera and giardiasis. Cholera also not very strong indication. Main indication, it should not take away the attention from proper fluid and electrolyte management. That is oral rehydration or IV rehydration, depending on the severity of the case. And giardiasis, of course, it requires anti-amoebic treatment and amoebiasis also. Zinc is an important part of diarrhea management, and zinc has been shown to be effective in reducing the diarrhea, and it should be continued for 10 to 14 days. And the dose is 10 milligram for children below 6 months and 20 milligram daily for children above 6 months. It is common in developing countries, zinc deficiency, and zinc deficiency is associated with impaired electrolyte and water absorption, decreased breast border enzyme activity, and impaired immunity. Treatment with reduces the duration and severity. So zinc is a very important discovery in diarrhea management. How can we prevent diarrheal diseases? This involves intervention at two levels: primary prevention to reduce disease transmission, rotavirus and measles vaccine. These are two vaccines. Measles is to improve the overall host resistance, because a child with measles, the diarrhea is important because epithelial damage. Diarrhea is an important complication of measles. And so particularly in African and Asian countries, and the severity of measles is very high in the malnourished child. According to David Morley, we'll come to David Morley, who had done a lot of work almost 5 decades back in Nigeria and Africa. A malnourished child is 400 times more susceptible to measles than a child with normal nourishment. So actually the way out of this is overall health of the child. No child will be malnourished. Unfortunately, we are still struggling with malnourishment, particularly the African and Asian continents. So this is just to tide over the crisis. The measles vaccine does make a important impact on child survival in African and Asian countries, particularly in pockets where the malnourishment and poverty is high. Rotavirus vaccine has been a disappointment. When it was first introduced, it was claimed to have a very high efficacy, above 70, 80, 90%, 90%. But as on today, the efficacy of the rotavirus vaccine is less than 50%. So any vaccine which has a less efficacy. And another concern of rotavirus is that one of the rare side effects of rotavirus vaccine is the intersusception. That is the intestine, they go into each part, they go into each other, and there is some sort of intestinal obstruction. A very rare side effect, of course. But unfortunately, most of the underdeveloped countries, the medical care in the periphery may not be available, and it may be difficult to manage interception. So one has to, though it is definitely, it is in the program, but it may not make much of an impact because of the decreasing efficacy of the rotavirus vaccine. So hand washing, other measures are definitely more important. That is hand washing with soap, providing adequate and safe drinking water, environmental sanitation. So we are failing in this. In fact, we are safe drinking water. We are moving away from public safe drinking water, and we are having this type of bottled water. In fact, whenever I go to class, I ask the students, how many of you have this? So 90% take out this out from their bags. And this bottled water, which is purchased. So I say this is the failure of public health, because public health means once we accept that the public water supply is not there, you are carrying private water supplies. That means your public health has failed, because the tap water should be safe enough to drink. So this is something which is commercial interest are there, because this also has got a commercial interest, and now everybody buys this. So we have to keep this in mind, that adequate safe drinking water available to all. Then only this endemicity or this high mortality from diarrhea and infection and malnutrition, this vicious cycle of infection, malnutrition, diarrhea, deaths, and then only we can eliminate them. Secondary prevention is very important. That is to reduce disease severity, and that is promote breastfeeding. Of course, this promote breastfeeding also should come in primary prevention and health promotion also, because it has been seen the breastfed child has got much less episodes of diarrhea than the non-breastfed child. Vitamin A supplementation, Vitamin A also improves the resistance to diarrhea, and treatment of episodes of acute diarrhea with zinc. So these are some of the measures. And simple solutions can save children by the integrated global action plan for prevention and control of pneumonia and diarrhea. Because a child comes, particularly a malnourished child, does not or may not come with only one illness. He may have or she may have diarrhea, then she may also have upper respiratory infections. These are the two major killers of children in the African and Asian continents. High infant mortality, the two major killers are the respiratory infections and diarrhea. So the integrated global action for prevention or control pneumonia and diarrhea, both are taken together. When a child comes, you have to examine the whole child. Diarrhea, then see whether the child has got, what is the breathing, respiratory rate and other things, whether the child is having pneumonia. In some pockets, the child may also have malaria also. So these all, they may be, that is called integrated management of childhood illnesses. So we have to see the child as a whole. And this is the way forward to protect, prevent, reduce, and treat. Protect is the health promotion, that is good nutrition, breastfeeding, overall hygiene, sanitation, water supply. Prevent, as I said, few specific preventive measures like measles vaccination, vitamin A prophylaxis, zinc, and to some extent measles vaccination, because the child get measles, the diarrhea aggravates, and reduce pneumonia and diarrhea morbidity and mortality. This can then syndromic management of acute respiratory infections, and then treatment. The two seat anchors of treatment are the syndrome for respiratory infections, syndromic management, grade 1, grade 2, grade 3, severity depending on the mild, moderate, severe. On respiratory infections, that also certain antibiotics can be given at the peripheral level by the healthcare worker. That is for pneumonia and respiratory infection. And diarrhea. This diarrhea, the main thrust is particularly peripheral level, particularly in underserved countries like continents like Asia and Africa. The peripheral health workers should be trained in rehydration, oral rehydration, and for pneumonia, when to start antibiotic. That can save many lives. And one step still further in diarrhea, not only the peripheral health workers should know how to manage the diarrhea of the child, all mothers and parents and community workers should know, volunteers should know. There are certain workers like ASA workers in India, there may be some community health workers, trained workers in African continent, and mothers particularly. They should know how to manage a child with diarrhea, because there have been studies have been done. And since the time of, as I said, David Morley, since 50 years, David Morley tried to educate mothers. He's a British pediatrician. He tried to educate mothers how to take care of diarrhea, how to weigh the child and monitor the malnutrition by Road to Health card. He was the one who first developed the Road to Health card, which is now used by WHO, which has been modified. And he was the one who emphasized the oral rehydration solution, the training of mothers, the awareness of mothers, and that is the way the diarrhea, because by the time, if the mothers are not aware in giving the oral rehydration solution, and by the time the child comes to the healthcare center or the hospital, the child condition may have deteriorated very rapidly. So, and these episodes of diarrhea are very common. I have got two latest studies I will give in the reference also. So they are, one is dated 2021 and one is dated 2022. There are two studies. The 2021 studies is diarrhea and associated factors among under 5 children in sub-Sahara Africa. This is evidence from demographic and health surveys of 34 sub-Saharan countries. They have done a study among 34 countries. It's published in PLOS One. I have given it in the end in the reference. They have pulled data from 34 countries, and they had found out the prevalence of diarrhea by asking the question to the mother. In the last 2 weeks, they have taken a large sample from 34 countries, almost 3 lakhs. And one of the question was, in the last 2 weeks, How many children had diarrhea? So they found 15% children in sub-Saharan Africa had diarrhea in the last 2 weeks. And in the next study, this is from East Africa 2022. So this study was done in 12 East African countries. So in this, they found 14%. So more or less same. In one study, 14% overall prevalence of diarrhea at any given time in the past 2 weeks. And this is 15%. And another very important finding is that we are still not reaching the mothers is that they ask the mothers also during the episodes of diarrhea, do you give the oral rehydration or any rehydration at home to the child who is having diarrhea? Only 32 to 40, 30 to 40, I'll just be showing the chart, at the most 40%. So 60 to 75 mothers, 60 to 70% of the mothers are still not giving the oral rehydration in the home, which David Morley had been trying for 5 decades. So this is unfortunate. Actually, so many lives could be saved by the mother. So it is the prevention and treatment, particularly treatment, early treatment of rehydration should be community-centric rather than hospital-centric. We may have the latest electrolyte imbalance and IV fluids and other monitor, but the actual damage is done in the community, and by the time the child comes to the hospital, it is a late stage, particularly malnourishment. So 30% children are still malnourished, various grades in African and Asian countries. Mothers are the one who should be trained. And then these two studies have also identified the factors which are associated with diarrhea, and which are the factors which are known since 5 decades. David Morley also identified without such big studies. It was the age of the mother's experience, mother's education, mother's training. All those factors are these are again inventing the same thing, but actually on ground, nothing is happening. I mean, the latest studies, 2022, and the studies, David Morley had written a book. I will be giving the reference at the end. He wrote it 50 years back in the 1970s. All these factors were identified in 1970s. Nothing new in this. So what we are doing actually, I mean, we are actually, it has to be the community centric and training of mothers. So this is, I just got carried away. So protective interventions, of course, breastfeeding also, David Morley has stressed 50 years back. Exclusive breastfeeding, that is, first 6 months of life, no other thing, not even water should be given, because it reduces the infection. Because and then it has got certain protective antibodies and other things. All diarrhea. And another thing is, this is the adults, they take this bottle, and the children, now working mothers are there. There is a challenge of breastfeeding. So there are ways and means. If you want, we should promote the breastfeeding in the workplace. Because mothers, most of the mothers now, there are social changes, the social transition. Social changes, most of the mothers are going back to work. And maternity leave is just for 12 weeks. You don't get maternity leave, that breastfeeding. The mothers have already joined the workforce. So there should be certain enabling environment that the mother should be able to breastfeed at the workplace. So there has to be some role models we will show. And it should be not stigmatized or any shame that she is breastfeeding in public. So this is an example of a member of parliament in Australia. Australian Senator Larissa Waters has become the first politician to breastfeed in the nation's parliament. So these can be, but these are isolated cases. So how many such high-profile women? So these can be the role models. We should promote this. Adequate and complementary 6 months to 2 years. That is again, after 6 months is again a difficult period where the top feed is introduced, and that can be a time when the diarrhea can come because of infection. So adequate, safe quantities of safe nutrition, age-appropriate food, continuous breastfeeding can reduce child death, including those due to pneumonia and diarrhea. And the weight monitoring is very important to Road to Health card. All mothers should be taught. High dose vitamin A supplementation helps maintain strong immune system. Children between us should be protected to 2 doses of vitamin A. Almost 60% attributed to unsafe drinking water, which I have been saying, hand washing, clean home environments, safe drinking water, and excreta, all known since decades. Nothing new. Then this is the recommended treatment acute diarrhea is the oral rehydration solution and zinc. And mothers should be taught how to make it hygienically. So this is the way, so as recommended by WHO, clean hands, container, 1 liter water, add, this is for homemade. Nowadays, in the chemist over the counter, you can get the packets. And in that, given how much water, 1 liter water, and it can be given. But if in a remote area, even if the packet is not available, the mother can make this at home, and half teaspoon of salt and 2 teaspoon of sugar and 1 liter of water. And this can be given. This is the diagram, and this can be given about 100 ml every. So this is the how weight to be multiplied. This is the amount one needs to drink over 4 hours by 75. To sip ORS every few minutes and until the signs of dehydration, that the child passes urine, no longer feels thirsty. These are the signs which can guide how much ORS is required at the periphery, and a strong pulse. Examine your center of drinking ORS for 1 hour and continue as you do. Alternative, babies under 2 years can drink ORS per day. Children at 10 can drink 1 liter of ORS per day, and children over 10 years can drink 3 liters of ORS per day. These are rough guides. The best guide is your thirst, your urine output, and your signs of dehydration. So this is every 5 minutes, 100 ml can be given. The child is having diarrhea. Use of oral rehydration salts and zinc and affordable treatment help prevent diarrhea deaths among children is too low, particularly across regions in sub-Saharan Africa and Middle East and North Africa. As I said, these are the graphs from different 2012 and 2022. The light blue color is the after 10 years. This is from the studies I had shown. So 2012, the 35%, 29%, and now it is 40%, some places 57%, that is South Asia. So these are the global surveys they have done, still more than 50%, and in some places 60% of mothers are still not giving oral rehydration at the home when the child is having diarrhea. They have a feeling that it increases the stools and all that. It may increase for some, but overall it will collect the dehydration. So this mother's education should be the thrust, which I think we are still not able to achieve 100%. So these are the percentage. That topmost is 100%. So we are still less than halfway to 100% as far as mothers' awareness and practice is concerned, giving oral rehydration to the child with diarrhea. So this is, I was talking of David Morley. David Morley was this the pediatrician from UK, and he spent his life in most of his working life in part of Nigeria, and mostly he worked on under 5 malnutrition. This is the Road to Health card in the background, which has been modified by WHO, and all the measures as advocated today had been advocated by David Morley almost in the 1970s and 60s, and his book is a classic, Pediatric Priorities in the Developing World. This is the 73, and what he wrote holds true in many Asian and African countries. In 1973, he wrote of Nigeria, 3/4 of our population are rural, yet 3/4 of our medical resources are spent in the towns where 3/4 of our doctors live. 3/4 of the people die from disease which could be prevented at low cost. Diarrhea is one, and yet 3/4 of medical budgets are spent on curative services. So which is holding true even today after 50 years. In 1956, he moved to Nigeria, where he took research at the Methodist Hospital and interested in measles and growth monitoring. Measles, as I said, rather David Morley said, is 400 times more severe in the malnourished child compared to the well-nourished child. He found low-cost healthcare initiatives within the community were more effective in treating infant mortality than hospital treatment, work that has influenced governments and agencies globally. So these are the reference, and first and two references are from the recent 21 and 22. And I think I just skipped some slides on rehydration. Let me go back few slides. I think some slides have just skipped by oversight. The actual management with IV fluids, microbial host, acute watery diarrhea, these are the lethargy, such treatment. This is the increased sodium. So I think that we have to be careful of severe acute malnutrition, methods of nutritional assessment. So I have stressed more on the community treatment of diarrhea at oral rehydration and at the level of the mother and the paramedical worker. I have not stressed much on the hospital because there it has to be monitored and it would be under expert care in any case. And majority of the mothers are not giving, 60% of the mothers are not giving. So we have to concentrate on that. In the hospital setting, of course, you have to give if the dehydration is very severe, sunken eyes and other things, grades, no urine, child is pulse is very weak. So that is severe dehydration. There are signs, and so that requires parenteral rehydration and oral rehydration at the community level. So I thought I will stress more on the community level because that is the thing where we are lacking. I think that's all I have to say. Any questions? I am ready to.
Thank you, sir. Thank you so much for the comprehensive talk. It was really very informative. And yes, sir, we have received few questions from the participating doctors. So with all your permission, can I share my screen to show you the questions?
Please, please.
Thank you, sir.
Shreyasi Clirnet has started screen sharing.
Is my screen is visible to you?
Yeah.
Yeah.
Yeah, this is important. What precautions should be taken when caring for someone with diarrhea to prevent the spread of infection? This is very important. First of all, we should have a proper disposal of the stools and vomitus if there, because we have to avoid the spreading of the infection, and other children will get, or other hospital patients will get, or even the healthcare workers will get. So the stools has to be properly, stools and vomitus have to be properly disposed. If there is a common, modern sewage system, it should go into that. Or if it is a makeshift arrangement, then it should be disinfected. The stools and vomiters should be disinfected by, say, 5% Cresol, which is easily available. And of course, the linen and other, and hand washing of the healthcare worker, hand washing of the patients. And these are important to spread because fecal-oral route is the mode of spread of diarrheal disease. So the fecal disposal of feces, disposal of vomitus, and washing of hands. If hands gets accidentally contaminated, it can transmit to other food items or other persons by shaking hands. So proper hand washing. Nails should be short, healthcare workers. So these are the way to prevent. Yeah, stress or anxiety, we all know before an examination, there is because they say the intestine or the abdomen is the sounding board of the emotions. So there is a important correlation between stress, mind, and the gut. Mind, gut. In fact, nowadays they are got one step further. They are certain studies, particularly they are concentrating on microbiome. So the microbiome of the gut can affect your brain. Of course, that those are the studies which are still evolving. We don't know, but at least it was well known that anybody, the autonomic nervous system gets activated. Your gastric motility may increase. Your intestinal motility may increase. The food may pass rapidly, so it can affect the GIT. So therefore, that's why the definition of health is complete physical, mental, social health. It is not only absence of disease. So when particularly acute diarrhea in children is easy to diagnose, it may be the cause may be infection. But if you are having chronic diarrhea more than 2 weeks, then the patient has to be examined about his mental state, whether he is having any anxiety, whether he is having any adjustment problems at work, home, and other things. So yes, the anxiety, stress is all related to the gut also. Okay. Are there any natural remedies or homeopathic treatment that can alleviate direct symptoms? I would say you may try homeopathy, they do no harm. Natural remedies may, there are certain things which are, you see, which can, like bananas, that is a natural remedy that gives pectin that can help in diarrhea. And diarrheal symptoms, most important is one should not go for these homeopathic remedies at the cost of not giving ORS. The seat anchor should be oral rehydration therapy, because that is the actual pathophysiology which causes the mortality of because of dehydration. So that should be there. After given that, having given that ORS, one can give homeopathy for whatever person believes in it, but it's very difficult to predict. Natural remedies may certain food items are there, like I said, banana or with pectin or other things, some late than natural remedies. And others I wouldn't know, but one should not try unknown remedies because some may irritate the gut. So you have to be very careful. Idea is to monitor the dehydration. And if that is there, you can. Thank you. What are strategies for preventing diarrhea outbreaks in communal settings like schools or nursing home? Very good question, because these are requires facilities. Like you should have adequate number of water closets, adequate number of toilets, and access to water. So safe water, hand washing facilities, and similarly for nursing homes. But in nursing homes, elderly people are there, that proper hygiene, because overcrowding may be there. So proper water supply and soap and water, that has been found in communal settings, like soap water, freely available soap and water. And unfortunately, water scarcity is common nowadays in many parts of the world. In, I think, South Africa, at one point there was no water, capital, Cape Town. And so that if there is, it's not only the quality safe water, it is the quantity of water for bathing, for washing hands. So those are more important than medications. So it's a overall services, quality of life, standard of living, all this diarrhea and other things will come down.
Shreyasi Clirnet has stopped screen share.
Well, thank you, sir. Thank you so much for answering all the queries of the doctors. And I would also like to thank all the participating doctors also for your continuous participation. And thank you once again, sir, for your valuable time, for being with us, sharing such valuable insights with us. So, with all your permission, sir, we can close the session over here for today. Thank you.
Thank you. It was a pleasure. Thank you.
Thank you so much, sir. Good night.
Good night.